7 million. Just let that sink in for a second. That is the staggering number of people around the world who die from heart attacks every single year. Cardiovascular disease, which covers heart attacks and things like strokes, is literally the world's leading killer. It's a massive global health issue. But here's the thing, understanding exactly how it works is absolutely our best tool for fighting it.
So, here is our roadmap for today. We'll start with the anatomy of a heart attack, then move into recognizing the true symptoms, looking at immediate emergency response, hospital diagnosis and treatment, and finally, preventing future heart attacks.
All right, part 1, anatomy of a heart attack.
It all boils down to a simple but fascinating rule. Just like every other muscle in your body, your heart absolutely needs oxygen to survive. It gets that fresh oxygenated blood from vessels we call the coronary arteries. So during a heart attack, the heart simply cannot get enough of it. It's literally an engine being completely starved of its fuel.
And this brilliantly illustrates the exact timeline of how that starvation happens. So as we age, fatty deposits called plaques start to build up on the walls of those coronary arteries. Over time, these can get chunky, hardened, or inflamed. Step 2, if one of these plaques ruptures or cracks, boom, we move right to step 3. A blood clot forms around it in a matter of minutes. By step 4, an artery that was maybe just partially closed can suddenly become completely blocked, cutting off blood flow entirely. And tragically, at step 5, within just a few minutes, those oxygen-starved cardiac cells actually start to die.
Now, in the medical world, this event is formally known as a myocardial infarction. Essentially, a heart attack occurs when those oxygen-starved cardiac cells die off, which severely impairs the heart's pumping rhythm and its overall ability to function. And without immediate treatment, things deteriorate rapidly, and in the worst-case scenario, this can lead to sudden death.
Moving on to part 2, recognizing the true symptoms.
Look, we are all familiar with the classic Hollywood symptoms, right? You know, the sudden, dramatic, crushing chest pain from that oxygen-deprived heart muscle, often radiating down the left arm, up to the jaw, or into the back and abdomen. But reality doesn't always look like the movies. Heart attacks actually often present with atypical, much less obvious signs that you really need to look out for.
What's truly crucial to know, and this actually surprised me a bit to learn, is that a lot of people experience atypical symptoms like sudden nausea or shortness of breath instead of that classic crushing chest pain. In women and the elderly, the signs can be even more subtle, mostly showing up as just severe weakness and tiredness. And get this, for many people, especially those with diabetes, a heart attack can be entirely silent. Because diabetes can affect the nerves that carry pain signals, they might literally not feel it happening at all.
Okay, part 3, immediate emergency response.
When every single second counts, the stakes are incredibly high, and the most important thing you can do is respond fast. Step 1, call emergency medical services immediately. No hesitation. They are hands down the fastest way to get to a hospital. While you're waiting, there are things you can do to keep the heart attack from getting worse. Step 2, take aspirin because it thins the blood. And step 3, if you happen to have it available, take nitroglycerin, which helps open up the artery. These are immediate, potentially life-saving actions you can take while you wait for the paramedics to arrive.
Section 4, hospital diagnosis and treatment.
Once you're in the ER, doctors have to rapidly solve a super high-stakes puzzle to figure out exactly what's failing. They'll almost always start with an electrocardiogram to measure the heart's electrical activity. Next, they run a blood test, which actually assesses the level of physical damage to the heart muscle. From there, the patient is usually rushed right into a high-tech cardiac suite, where very specific tests are run to pinpoint the exact location of the blockages.
And it is absolutely incredible what modern cardiologists can do to reestablish that circulation and get the heart functioning again once they find the block. First up, they might perform an angioplasty. That's where they inflate a tiny balloon inside the blocked artery to literally push it open. Next comes stent insertion, where a tiny metal or polymer mesh tube physically holds that artery open. For more severe or extensive blockages, heart surgeons might need to step in and perform coronary artery bypass surgery, which completely reroutes the blood flow around the damaged area. It's really amazing stuff.
Finally, part 5, preventing future heart attacks.
Now for the incredibly empowering news. Prevention is vital, and it is entirely possible, whether you've already had a heart attack or not. Doctors heavily recommend getting regular aerobic activity and mixing in some strength training. Committing to a solid exercise plan a few times a week doesn't just strengthen the heart itself, it also facilitates crucial weight loss, which directly plummets your overall risk.
And of course, a heart-healthy diet is heavily focused on what you should eat just as much as what you shouldn't. You definitely want high fiber and lots of veggies. You want to opt for chicken and fish over red meat, and you really want to incorporate whole grains and nuts. Specifically, things like walnuts and almonds are great. Conversely, you've got to keep your diet low in added sugar and saturated fats because both of those are directly linked to heart disease.
But what about beyond just diet and exercise? Well, doctors also have some pretty powerful pharmacological tools at their disposal. Specific medications can actively manage underlying risk factors like high blood pressure, high cholesterol, and diabetes. They also frequently prescribe a daily low-dose aspirin, especially for high-risk patients, just to help keep those vital pathways clear and make heart attacks far less likely.
So what does this all mean? What is the ultimate lifestyle cocktail for maintaining your body's most important engine? Turns out it's a mix of eating a healthy diet, avoiding tobacco use entirely, staying fit, getting plenty of sleep, and honestly, even enjoying lots of laughter. All these elements go an incredibly long way in making sure your heart keeps beating strong. Remember, heart attacks might be a common global killer, but they absolutely do not have to be inevitable if you take care of yourself.